Hi everybody, welcome to Beauty Buzz with Lori. So today we have Dr. Garcia with us. So Dr. Garcia, I thought it would be a great time for us to talk about the aging face. So a lot of people think that the aging face, we only see the skin, but there are many layers beneath the skin that also have the sagging effect due to gravity. So I wanted us to kind of talk about that.
Before I talk about layers, I think it's also important to talk about the forces of aging. So we live in a force, and that force is gravity. And people don't think about it as a force because we're used to it. We're born and we live and we die under this force. So relatively speaking, we don't feel it, but it's a constant force that's being exerted on our body. Gravity is a vertical force, up and down. So that means that when that force is applied, things will fall in a downward direction. From the aging perspective, all of those tissues are affected in a vertical direction down towards the feet. The other part that happens is the volume in the face is depleted. The biggest contributor of volume in our face is the subcutaneous fat, but there are also distinct fat pockets in our face that become depleted or become smaller as we grow older. So looking at the layers of the face, if you were to break it down into a structural system or perspective, obviously you have the skin. Just below the skin, you have subcutaneous fat. Below the subcutaneous fat, in the face and the neck, you have the superficial muscle of the face. There's an acronym for it in the face. It's the SMAS, S-M-A-S. It stands for superficial musculo-aponeurotic system. In the neck, the same anatomical layer is called the platysma muscle. And below that superficial muscular layer, there's a little bit more fat. And then you have the deeper structures of the face. Specifically in the face, you have the muscles of facial expression. Those are the muscles that move when you smile, when you cry, and so on and so forth. Below those muscles is the bone. And people don't think about the bone as tissue, but it is tissue. It's living tissue, and it is also affected by gravity. All of those layers are affected by that force that we talked about. In combination with that volume loss that takes place, we interpret those changes as the signs of aging vis-a-vis shadows. And so what we look at in the mirror when we think that we're looking tired or we're looking older, it's really shadows. And those shadows are directly caused by gravitational changes and volumetric changes.
Okay. We see that where gravity has literally pulled everything down, and that's where we get like our nasolabial folds, our marionettes, the jowling that we all see, and then those platysmal bands that kind of, correct me if I'm wrong, separate and hang down, which is how we get what they refer to kindly as the turkey neck or whatever. What are some ways non-surgically that we can help to mitigate some of those things early on? And I always recommend my patients start in their late 20s and move forward with that because it will help their aging process moving forward.
Yes, so the biggest thing that you can do for yourself is skincare. That's an easy thing that will affect a positive change as we're older. It slows down the aging process in your skin. Moisturize your skin, whether you use products, whether you do facials, whatever you decide to do. That is an easy thing to do early in your life that will have positive repercussions as you grow older. Going deeper than that, there are always processes and things that we can do to tighten the muscle non-surgically. There are things that we can do like adding volume back in the face to kind of camouflage those shadows. But ultimately, the long-term kind of gold standard solution to the aging process is to actually move that superficial muscle and reposition it. And that's really what reverses the signs of aging. So it's a surgical solution, but I understand a lot of patients don't want the surgical solution. And so there are things that we can do like fillers, like ultherapy, which is high energy ultrasound to tighten the muscle. Things like that can camouflage and temporize those basic problems.
Can we talk a little bit about how genetics also plays into that for the aging process?
Yeah, that's actually, in my experience, the biggest effector of the aging process. It's hereditary. And if people think about faces that are familiar to them, like their parents, their aunts, their uncles, there's a correlation between how your relatives have aged and how you're going to age. I find that that's the biggest effector in the aging process. In terms of things that exacerbate exacerbate the aging process. Sun exposure. I've seen sun exposure prematurely age skin many, many times. Lifestyle choices like cigarette smoking, like alcohol abuse. You know, stressful life can also affect the way we age. Diet can affect the way we age. Oxidative stress, that's the biggest effector of inflammation in our body. And so not only does it affect the rest of the body, but it affects the skin and the aging process. Most patients can mitigate those things either through lifestyle changes or through these ancillary procedures that I talked about.
One of the things that I know you also like to make patients aware of when you're meeting with them, and I've adopted that as well, is making sure that they know that we have limitations.
Yeah.
We're not miracle workers per se, and not trying to be mean when we say that, but I mean, we do have limitations from a surgical standpoint as well as from what we can produce from a non-surgical treatment.
Well, you have two different types of limitations. So my biggest limitation when I operate on patients is not making them look unnatural. And we've all seen people who look unnatural as a result of cosmetic surgery. So that's one of the guiding principles in my practice. Is my goal is to make people look better and refreshed, but it's never to make them look like they've had a procedure. Like from the physical perspective, when we perform surgery, it's like any other surgery. Blood supply is extremely important. So if you are operating on tissue and you're tightening that tissue so much that you compromise either the ingress or the egress of blood, that tissue is going to die, and then you're going to have a serious problem with tissue loss and scarring and so on and so forth. In terms of the overall limitation, or the kind of the strategic limitation, if you have a very advanced problem, we're not going to make you look like you looked when you were 20 years old. If I can use the baseball analogy, the goal is to have you hit a single or a double, but the moment we start swinging for the fences with procedures, guess what? You're going to strike out most of the time.
Basically, what we want you to walk away with today is hopefully having some of those mid-aging face questions answered. However, we also provide consultations. Dr. Garcia does aging face consultations to where he can allow you to express your concerns, and then he can give you solutions and let you know what can work for you and what might not work for you. The same with myself and with our nurse practitioner, as well as our oral therapy technician. We all do consultations in order to inform you and educate you so that you can make an informed decision going forward. Call our office, and we look forward to hearing from you. Thanks for watching.